The superior mediastinum is bounded anteriorly by the manubrium sterni, and the lower border of the superior mediastinum is an imaginary line from this point, which is the angle of Lewis, going backward into the lower border of the four thoracic vertebrae. If we removed the anterior chest wall and we started to look at the superior mediastinum, first we will encounter the veins. Those are the left brachiocephalic and the right brachiocephalic veins. The left brachiocephalic vein is formed by the union of the left subclavian and the left internal jugular veins, accompanied by the left external jugular vein. Then the left brachiocephalic vein crosses the midline to meet the right brachiocephalic veins, which is formed similarly from the right subclavian and the right internal jugular. When the left and the right brachiocephalic veins meet, they form the superior vena cava. The superior vena cava goes downward to enter the right atrium, and before entering the right atrium is joined by this vein from behind. This vein is known as the azygos vein. Here it is, the azygos vein joining the superior vena cava, and then the superior vena cava enters the right atrium. To the left of the superior vena cava is the ascending thoracic aorta. The ascending aorta bends to form the arch of the aorta. The arch of the aorta gives three branches: the brachiocephalic trunk, the left common carotid artery, and the left subclavian artery. The brachiocephalic trunks divide to give the right common carotid artery and the right subclavian artery. Below the arch of the aorta is this structure, which is known as the ligamentum arteriosum, that connects the arch of the aorta to the pulmonary trunk, and this is a remnant of the ductus arteriosus in the fetal life. The vagus nerve, this is the left one, the left vagus nerve, descends lateral to the mediastinum, anterior to the arteries, and then it goes behind the root of the lung. Here is the left lung root, and here is the vagus nerve going behind the lung root. Here it gives this branch, which is an important branch known as the recurrent laryngeal nerve, which is the left one, the left recurrent laryngeal nerve, that hooks below the arch of the aorta and the ligamentum arteriosum to ascend back into the neck. Here I am pulling it from the neck. The right vagus nerve have a similar pathway, but the only difference is that it gives this branch the right recurrent laryngeal nerve higher up in the region of the neck, and it hooks below the right subclavian artery, and then the rest of the nerve descends below, posterior to the lung root. Here is the right lung root, and here is the vagus nerve going behind the right lung root to reach the esophagus. The phrenic nerve runs anterior to the arteries and lateral to the vagus nerve. Here is the phrenic nerve and here is the vagus nerve, and it descends anterior to the lung root. Here is the left lung root and here is the left phrenic nerve, and it's seen going between the fibrous precardium and the mediastinal part of the parietal pleura. It's accompanied here by this vessel which is known as the precardiophrynic vessels. Then the phrenic nerve descends into the diaphragm. The trachea, with its C-shaped cartilages, divides at the level of the sternal angle into a right, shorter, wider, and relatively straight main bronchus, right main bronchus, and a left, longer, narrower, and more oblique left main bronchus. The right main bronchus enters the right lung, and the left main bronchus enters the left lung.